Alright, people, what's happening? So, this is the update for my fourth week of ACL plus meniscus surgery recovery. So, end of fourth week, going towards the fifth week, no more pain, sleeping okay, and I can stand and sit as long as I want. At the start, when I was sitting down for too long, my calves started to swell a little bit. So, that was a little bit uncomfortable, but you know, gradually it went away and now it's totally fine. Started to go back to work, so now I've went back twice last week, and that was also why I was sitting down for the, almost the whole day, and my calf started to swell up. But it's fine now. I went to a physiotherapy review, so apparently flexing no more problem, like the doctor said. 90 degrees flexion, everybody gets there eventually. Straightening, yeah, some problem with completely straightening my leg. It's um like when I went to like I from if I don't warm up and I just straighten my leg, it's still stuck at 5 degrees. So it's not completely straightened, it's still stuck at a little bit of 5 degrees. And the therapist told me it's because um, my hamstrings and my calves around the knee area is too tight. So he's adding in for me a new calf stretch where I lie completely still. No, where I straighten my leg completely and I pull a towel. I use a towel and pull my calves inwards, right? As I try and straighten my leg, and that's helping. And also he's saying I can start to do some hamstring curls. So apparently, if I if I swing my knee, if I swing my knee like this, it's not good because it's not good for the ligament, the new ligament, and the meniscus repair. But I can definitely curl my knee backwards. So I can't swing my knee forwards. I can curl my knee backwards. So I'm doing new hamstring curls. I'm lying down and hamstring curl just without weight, about 90 degrees, just to start to strengthen the hamstrings. So that's good. And I have been going to the full size Olympic swimming pool. So I'm swimming every day for about 1 kilometer, and then I'm going to the gym. So that's good. And I started on collagen. So I think nutrition is really important. I've been taking glucosamine, vitamin C pills, collagen, and some Chinese meds to help with the recovery. I almost slipped twice. I slipped twice. I didn't fall to the floor, but I had to, I slipped twice and I had to emergency. I have to use my left leg, and weight bear a little bit in those situations, which is not ideal, right? Because the whole purpose of isolating my left leg is to let my wounds heal, my meniscus repair heal. So if I slip and I use my weight, that's not good. So I think you really have to be careful of slippery surfaces. So for the routine, it's still I wake up, I stretch. Now I'm adding the calf stretch, which is helping with the leg straightening. I do a massage, which helps with the swelling and hopefully helps with the scar tissue and the flexibility. So that's really good. I really feel like the swelling has gone down. It's going down every day, and I don't feel any pain when I wake up. It's stiff, so I need to warm up a little bit before I can enjoy the range of motion. But once I get there, the pain is getting less, and in fact, these few days, no pain. Then I do my PT exercises, my physiotherapy exercises. So I'm adding the hamstring curls, lying down hamstring curls, and I'm adding a isometric. So I remember last time when I was doing kung fu or wushu, we used to have to hold a position where the leg is straightened, and you have to hold it parallel to the floor, and I used to do that for like 3 minutes, right? So you just keep your whole leg straight, extend it out, and hold it there for 3 minutes. Now I'm doing it on my injured leg, and of course it's not parallel to the floor because it's not strong enough. I'm kind of holding it maybe 45 degrees, right? And I'm trying it for 30 seconds first, and let's see how that goes. Once I finish the physiotherapy exercise, I do some ballet exercises. I've talked about it in the past. Go see a video, and then I go to swim. Right, I swim 1 kilometer every day. It helps with my blood circulation. It feels really good, and yeah, it's quite amazing because I go to the swimming pool with my crutches. I'm really careful not to slip. I haven't slipped in the swimming pool near the swimming pool yet, and then I get as near to the pool as possible. The public is there. They're staring at me. What is this guy doing here? And I have to then place the seats where I put my crutches and I change. It's about maybe 2 meters away from the pool. Then I have to crawl to the pool, and then the kids will stare at me. What is this weird uncle trying to, crawling on his hands and leg and lifting one leg behind my injured leg. I just try not to put it on the floor. So just crawl to the pool, and then swim, and then crawl out. Yeah, I don't know. Well, it feels good for me. And then I go to the gym immediately to do my upper body exercises. So I think this week I'll film my gym exercises, so watch out for that video. And then after that, I go through a bunch of nutrition, which I include vitamins, collagen, glucosamine, Chinese meds. All right, so that's my routine for the day, every day. And I must say, this whole therapy thing, recovery thing, it's not easy, right? So it's time consuming. It's not painful, but I must say I dedicate at least 4 hours daily for my rehab. Well, I hope it's worth it. So objectives wise, week 4 objectives totally done. I am not concerned with the range of movement anymore. Yeah, a little bit to get 0 degrees, but not concerned. And really, like I said, once it's warm up, straightening and flexing to 90 degrees, totally fine, and during the day, it doesn't bother me. Range of motion does not bother me at all, no pains. I can't go beyond 90. I'm prohibited to go beyond 90 because apparently once I go beyond 90, that deep flexion would cause the meniscus repair some problems. So we still have to wait for my doctor's clearance for that. Week 5 objectives. So I want to start increasing the difficulty and maybe the reps for my leg physiotherapy. I do feel that after 4 weeks of non-weight bearing, my muscles are really weak, and of course, I can't fully involve them until I weight bear. But as much as possible, I want to slow down the atrophy and the weakening. So I'm gonna do more for my quads, right? So make the PT a bit harder, maybe add weights, maybe do longer, do more reps. I don't know yet, right? Another objective is to get more calf stretch in, so that's there. Every time I stretch, I add that, and to get to 0 degrees easier. So just to loosen up the hamstrings and the calf muscles around the knee area, so that I get to 0 degrees easier. Well, the last thing is to be patient. So still no weight bearing on my left leg. I need to remind myself to be patient. I've been reading where people are, some of the other patients are more, they go back to weight bear a lot faster, and that gives them problems for future recovery. So I don't want to do that. I want to let my meniscus recover completely before I go back to strength training again. Alright, so that's a quick update for week 4, and I see you guys next week.